Welcome to OOTO TV, the out-of-the-office investigation from the past into the future of personal health and actualization. This time, we're discussing lymphedema and gout, diagnosis and management options. You know, when I first started looking into this, I thought, okay, two different things, but the sources, wow, they paint a picture of this huge, interconnected, inflammatory network.
You really hit the nail on the head there. Our mission today isn't just to talk about gout and lymphedema separately. It's about weaving together the findings, especially with these advanced imaging techniques like dual energy CT. They show us that gout, the crystal thing, and lymphedema, the fluid thing. They're often fighting on the same battlefield, molecularly speaking.
It's such a powerful link. So, okay, today we're going to explore those shared inflammatory pathways, and we'll look at how crucial lifestyle is: diet, hydration, even specific things like lymphatic massage. Plus, we'll touch on the newer diagnostic tools that are kind of changing the game. Let's just jump straight in. What's really driving these conditions deep down?
Well, to get gout, you have to start with inflammation. And it's fundamental, we have to state this clearly. Uric acid buildup forming crystals is the primary cause of inflammation causing gout. These are called monosodium uric crystals, or MSU.
Right, MSU. And these aren't just like passive little rocks sitting there, are they? They're active triggers.
Exactly. They're biological alarms. When these crystals land, especially in a joint, bam, you get this immediate, really intense immune reaction. We're talking toll-like receptors firing off, complement activation. Basically, the body sounds the alarm and neutrophils rush in. And what's fascinating is how specific it gets.
You mean those molecules involved in autoinflammation, the ones we hear about?
Precisely. The sources really point to the NLRP3 inflammasome and interleukin-1 beta IL-1B. These are like the key generals directing this hyperinflammatory state in gout. It's fundamentally an autoinflammatory response, really driven by these pathways.
Okay, so that's the intense, crystal-driven fire of gout. Now, let's switch gears slightly to lymphedema. On the surface, it seems more like a plumbing problem, right? The lymphatic system can't clear fluid properly, often in the legs.
That's how it often presents, yeah. But it quickly becomes more than just backed up fluid. It really evolves into a chronic inflammatory disorder. Lymphedema is defined as being caused by ineffective fluid uptake by the lymphatics. And this leads down a path of lymphatic damage, scarring that's fibrosis, and even abnormal fat deposition. The inflammation is really what locks it in as chronic and damaging.
And the research seems to have pinpointed a specific inflammatory molecule that really bridges that gap between, general inflammation and the lymphatic system failing, leukotriene B4 or LTB4.
LTB4 is critical here. It's a molecule we know from general immune responses, but in lymphedema, it actually plays a really harmful role. It messes with the inflammation, sure, stimulating cells like Th17, but crucially, the research shows LTB4 directly harms the lymphatic endothelial cells, the LECs, the cells lining the lymphatic vessels. It basically gums up the works, making the lymphatic system less effective and worsening the condition.
So we've got two distinct conditions, gout and lymphedema, but both are fueled by these really specific, intense inflammatory signals.
Exactly.
Okay, this leads us to the diagnosis part, and honestly, this was the biggest wow moment for me in the source material. Researchers used dual energy CT, DCT, and ultrasound on people with gout in their feet, and they look not just in the joint, but around it.
Right. Standard practice is to look inside the joint for those MSU crystals, but they widened the view, looked at the surrounding tissues, and what they found, well, it showed a huge overlap, physically and pathologically.
The numbers are just staggering. Subcutaneous lymphedema, that's the swelling in the tissue outside the joint, was found in 58.2% of patients who had acute gout flares in their feet. 58%. That's way too high to be just chance.
And the statistics really nail it down. The presence of lymphedema was significantly tied to extraarticular MSU deposits. That means crystals found outside the actual joint capsule. And get this, the odds ratio was 43.3.
43.3. Wow. So what does that actually mean in simple terms?
It means that if you have those MSU crystals outside the joint space, in the surrounding tissue, you are over 43 times more likely to also have lymphedema in that same area. It dramatically highlights that the disease showing up outside the joint is a massive factor in developing lymphedema. It suggests that the crystal deposits themselves are causing severe stress and even failure in the local lymphatic system.
That odds ratio, 43.3, it's like the smoking gun connecting those chronic crystal deposits directly to the lymphatic system breaking down. It really shows the kind of widespread tissue damage these crystals can cause.
You're listening to OOTO TV, with research by author Paul Balow.
Okay, so we've established these really strong links, physical, inflammatory, between gout and lymphedema. The obvious next question then is, how can lymphedema and gout be managed?
Yeah, and the answer is it really takes a team effort, a coordinated multidisciplinary approach. For gout, the strategy is pretty well defined now. It's treat to target. That means using urate-lowering therapy, ULT medicines, to get your serum urate level below 6 milligrams per deciliter and keeping it there, ideally lifelong. Plus, you need ways to manage acute flares when they happen into TIAIDs, maybe glucocorticoids or colchicine.
Okay, that's the gout side. What about lymphedema?
For lymphedema, the cornerstone is something called comprehensive decongestive therapy, or CDT. It's a whole program.
Right, and listening to this, you need to know that this is where your personal input becomes absolutely critical. It's just so important to state that your diet, hydration, and exercise drives lymphatic system and health. These are things you, the patient, can often influence directly.
That's absolutely right. And looking at the source material on how personal habits affect this, well, it leads us to state that your personal diet and behavior is the primary driver of the lymphedema progression, at least in many situations. Now, just for that bit of contrary perspective, while diet and behavior are definitely critical, obesity alone accounts for maybe 44% of the population risk for high uric acid, and it makes lymphedema risk worse too. We do need to remember that secondary lymphedema, that's the kind not from genetics, is very often caused by things like surgery, infections, or injuries. So it's complex. It's not always just about lifestyle choices.
That's a really fair point, a necessary clarification. But sticking with management, focusing on those controllable factors is key. Which brings us to ask, can we manage gout and reduce inflammation by diet and hydration?
The sources are a bit nuanced on this one. Diet is hugely important, no question, for overall health, for managing weight, other issues. But the data indicates diet alone is usually not enough to hit that strict under 6 target for serum urate in most people with gout. Genetic factors often just play too big a role in how your body handles uric acid.
Okay, so diet alone might not fix the gout number, but it doesn't mean lifestyle isn't critical for managing the overall inflammation, especially when lymphedema is involved too, right?
Absolutely not. It's still essential, which is why we should state clearly, thoughtful management of diet, hydration with whole foods and clean water is key to managing lymphedema and avoiding gout flares. Think of diet not as a sole cure, but as a vital part of the support system.
And there's even some specific research, which I found fascinating, about targeted nutrition that might act against those specific molecules we talked about earlier, like LTB4.
Yes. Hydroxytyrosol, it's the polyphenol you get from olives. Early research looks promising because it seems to have strong anti-inflammatory effects. And why? Because it specifically seems to reduce the body making LTB4. That's the molecule we said messes up lymphatic function. So it shows how potentially specific nutrients might directly intervene in how lymphedema develops or progresses. Really interesting stuff.
Beyond what goes in, what about managing things physically from the outside? We need to ask. What are key elements for lymphedema drainage by diet, hydration, and massage?
Oh, the physical therapies are absolutely fundamental for lymphedema. Lymphatic drainage massage is specifically recommended. The idea is to manually help move that sluggish lymphatic fluid along. And by doing that, you might also help the body flush out excess uric acid, reduce the swelling, the edema, and maybe even lessen the chance of crystals forming in those soft tissues.
How is this kind of lymphatic massage different from, say, a regular deep tissue massage? Is it the technique?
The difference is huge, and it really comes down to pressure. There's manual lymphatic drainage, MLD, usually done by a certified therapist, and simple lymphatic drainage, SLD, which patients can learn to do themselves. For MLD, the key is extremely gentle pressure. It seems counterintuitive, but if you press too hard, you actually bring more blood flow to the area, which kind of defeats the purpose of clearing the lymph. The technique is all about gently stretching the skin to encourage fluid away from blocked areas towards working lymph nodes.
Gentle is key. And what about other physical things? Compression.
Oh, absolutely indispensable for long-term control. Things like multi-layer inelastic lymphedema, bandaging MLOB, and then wearing prescribed compression garments consistently. Regular exercise tailored to the individual is also important, and meticulous skin care. This is crucial. You need to keep the skin on the affected limb healthy, well moisturized using emollients, preferably ointments rather than thin lotions to prevent cracks or infections, which can be really dangerous in a lymphodematous limb.
Right. Keeping that skin barrier intact is vital. Okay, before we wrap up and synthesize, we should probably touch quickly on pain management, given how inflammation is central to both conditions.
Yes, good point. And the consensus here is pretty strong now. Experts widely caution against relying on long-term opioids for chronic pain and inflammatory rheumatic diseases like gout or related pain. The evidence just isn't there to show long-term benefit for function or pain, and there are significant risks and side effects. The real focus needs to stay on targeted non-drug approaches, like the therapies we've discussed, and appropriate non-opioid medications when needed. You're listening to OOTO TV with research by author Paul Bello.
This has been really illuminating. So if we try to synthesize this, bring it all together, that core aha moment for me is really understanding that lymphedema and gout aren't just conditions that can happen in the same person. They are often pathologically intertwined in this shared inflammatory landscape. And that's powerfully shown by that crazy statistic, the odds ratio of 43.3 linking crystals outside the joint directly to lymphedema.
Absolutely.
Yeah.
So if we boil this down to maybe 3 key takeaways for you, the listener. First, gout. It's fundamentally driven by crystals causing inflammation. Management demands that precise treat-to-target approach with medication to keep uric acid below 6 mg/dL.
Second takeaway, lymphedema. It's a chronic inflammatory issue where specific molecules, especially that LTB4 we mentioned, actively sabotage the lymphatic system's function, leading to that cycle of fluid buildup, damage, and tissue changes.
And third, managing both conditions effectively, especially where they overlap in the limbs, hinges heavily on personalized non-drug strategies. That means things like consistent, correct compression therapy, that specialized gentle lymphatic massage, and really disciplined lifestyle changes around diet and managing obesity. It holds true even if the primary lymphedema is genetic. Management is really a partnership between you and your healthcare team.
Which brings us to a final provocative thought, sort of building on those diagnostic advances we mentioned. We talked about dual energy CT, how it can not only spot gout crystals, but actually measure the volume, how much crystal is there.
Right, and here's the question that raises. We know that the amount of MSU crystal burden is linked to broader systemic risks, including things like heart disease. So, should measuring this crystal volume with DECT become maybe a standard predictive tool? Could it help manage all the related heart and metabolic risks that often come along with gout? It shifts thinking from just treating arthritis to assessing whole body risk.
That's a really powerful idea. Could turn a joint diagnosis into a systemic health predictor. Well, thank you for joining us on OOTO TV for this exploration of lymphedema and gout.
Yes, and we really hope this conversation has prompted you to think about those deep, sometimes hidden connections between systemic inflammation and conditions that might, on the surface, seem quite localized or just structural.